Good morning, everyone. This is the Healthcare Build Up Illinois Coalition press conference for Vertical Capital, and the focus will be healthcare. So I want to introduce and start off with Larry McCulley of Touche Regional Hospital, SIHF Healthcare, and the Illinois Primary Healthcare Association. Larry?
Well, good morning. As Danny had noted, I am the president and CEO of Touche Regional Hospital, a safety net facility in Centerville, Illinois. SIHF Healthcare, an FQHC that runs primary care facilities, dental facilities, behavioral health facilities across central and southern Illinois, and presently serving as the board chair for the Illinois Primary Healthcare Association. Today I am joined by several healthcare leaders across the state who are part of Build Up Illinois Coalition to encourage and urge the governor and the General Assembly to include healthcare as part of the capital program. My service in the multiple roles I have denoted provides me a unique perspective on the needs and the healthcare delivery services of the vulnerable populations across southern Illinois and throughout the state. Our healthcare delivery system is in drastic need of capital programming to support our ability to transform and continue to expand our access, to address racial disparities, and move forth the health status improvement of our citizens across the state. A perfect example of this is our hospital, Touche Regional Hospital, which is located in greater East St. Louis, physically located in a community called Centerville. Centerville happens to be the most impoverished community in our state and in our nation. Our patients include 11% who are uninsured, 65% that are Medicaid. It's a hospital that partners with our FQHC, SIHF Healthcare, to expand access to primary care, dental, behavioral health specialists, and ambulatory services. It is a true safety network for health for our vulnerable patients. Touche and other safety net hospitals in Illinois are essential healthcare providers. They're also essential and vital job creators in our communities. We represent the voices of our patients in our communities, and we are often located in communities of high unemployment and of greater racial disparities. Our hospitals, our safety net hospitals, face great challenges, financial challenges, due to the significant underserved, uninsured, and Medicaid patients we serve. Those financial challenges often limit our access to capital markets for construction, expansion, and equipment upgrades. These same challenges transcend over to my experience and role with our FQHC and my role with the Illinois Primary Healthcare Association. We represent health centers across the state of Illinois who are critical delivery aspects to our healthcare delivery system for vulnerable patients, impoverished patients. SIHF Healthcare is one of the largest federally qualified health centers in the nation, serving more than 105 individual patients each year, of which most are 200% of poverty and below. Our community health center, along with others, are in the mix of transforming our models for integration. Integrated models that, through research, has proven to be highly effective and most cost-effective for our communities and our payers. We have been able to demonstrate reduction in inpatient volumes, improve patient outcomes, and reduce cost. But our safety net hospitals and our community health centers across the state do not have the resources to make capital improvements to transform our delivery systems to address the breadth of healthcare needs that exist today. Needs such as facility expansions, equipment deployment, telemedicine, behavioral health integration, substance abuse treatment. We cannot do this unless the state enacts a capital program that includes healthcare. That is why today we are urging the governor and General Assembly to invest in healthcare as part of the capital program so we can continue to improve the health of the most vulnerable patients in urban and rural areas, and so we can strengthen the economic health of our impoverished communities by creating jobs that can build a workforce for tomorrow that can continue to build our economy and sustain growth towards better health in our areas. At this point, I would like to invite up Representative Greenwood, my representative, to speak.
Thank you. Thank you, Larry. Good morning. My name is Representative Latoya Greenwood. I represent the 114th District, including areas like East St. Louis, Cahokia, Centerville, Allerton, and other communities of color with extremely high unemployment rates and increased rates of trauma. Centerville, where Touche Regional Hospital is located, has been cited as the poorest community in the United States of America. People in these communities suffer for lack of access to necessary resources, but most importantly, they suffer for lack of access to quality health care. As a safety net hospital, Touche provides much-needed health care services to my community, regardless of race or socioeconomic status. Touche also partners with community health centers to provide medical care, behavioral health care, dental care, and other much-needed services that help improve health outcomes while lowering the cost to the state. Through the partnership with the Community Health Center, Touche engages people in the community to ensure that their health needs are met. Over 70% of the patients seen at Touche are on the Illinois Medicaid program, and the rest are on Medicare. Touche does not have the luxury of commercial insurance patients like other hospitals do. They do not have extra money to buy new equipment, upgrade their facilities, or install the latest technologies because they have no money to do so. The people in my district should not be forced to travel great distances or receive any less quality of care simply because they are not rich. It is high time that the state stops disinvesting or de-investing in these communities and start reinvesting. Therefore, I am requesting that the General Assembly include at least $150 million in much-needed capital dollars for safety net hospitals in any capital infrastructure bill. We need to protect our most vulnerable communities, and I am grateful for my colleagues here today and hospital leaders that are standing with me today. Thank you.
Next up is Tim Egan of Roseland Community Hospital in Chicago.
Hello, my name is Tim Egan. I'm the CEO of the new Roseland Community Hospital on the far south side of the city of Chicago. I hope everyone will forgive me for being a little tired this morning. My son played a baseball game on Waveland and Lakeshore Drive, and the game ended about 9 o'clock. So I got in Springfield about 1 a.m., and I'm a little tired. My eyes are a little bloodshot, but there was nothing, not even a triple header last night, would have kept me from coming here today to speak on behalf of the new Roseland Community Hospital and the other 19 safety net hospitals across the state. It's high time the state of Illinois begins to invest. Just as the representative said, no more divesting should be allowed for safety net hospitals. Rather than divest, we need to invest in safety net hospitals. Like many others, the new Roseland Community Hospital survived the last 4 years under a governor who was hell-bent on destroying the safety net system in Illinois. And regardless of what his efforts were, or his administration's efforts were, I'm here and glad to be here to tell not only our friends but our enemies that the new Roseland Hospital is alive and still standing. The doors are open. But ladies and gentlemen, the unemployment rate in the new Roseland community is 206% of the national level. Our Medicaid percentage is over 80%. We don't have commercial insurance patients to offset the low cost of Medicaid reimbursement. It just doesn't happen at the new Roseland Community Hospital and our other safety net hospitals as well. The new Roseland Community Hospital in Chicago has the highest prevalence of asthma and respiratory disease in the entire state. That's been identified. However, our hospital does not have the state-of-the-art respiratory treatment equipment that hospitals in wealthy areas have. It's one of the graphics we're showing here today, and one of the reasons why we're asking for capital funding is to create the Center for Breathing Easy to alleviate the asthma, the epidemic-like asthma conditions in the greater Roseland community. And I know that Senator Jones is here today. He's going to speak eloquently, but I want to say that he suffers from asthma. And I'm not violating any HIPAA, because he'll tell you herself that Roseland is the hospital that provides the care for Senator Jones. But there's no reason that any other citizen should be denied the health care access to how much money they make or where they live. It's just not right. It's not where we should be as a state. You're going to hear a lot of talk about why the patient should follow them, or the money should follow the patient. Well, Roseland Community Hospital doesn't have the specialists to treat the patients where they live. So we have to refer them to Mount Sinai or Cook County Hospital. So should the money, the Medicaid dollars, go to those institutions? So our patients who are suffering from asthma or sickle cell anemia have to get on 3 buses and a train to go find treatment. That's just not where we should be as a state. The money should go to the communities where the patients live, so they can be treated comfortably where they reside. We are requesting money to build these new outpatient respiratory center so the South Side receives the access to quality care that the patients deserve. Why should residents on the South Side, who already lack access to transportation, have to travel these great distances? Roseland Community Hospital is also the economic engine of the community. We have seen a disproportionate share of divestment in the recent history, and now it's time to invest. Somehow, I always find myself here in the last few weeks of session tired, but ready to fight. We're in Springfield here with our associates and our great elected officials to continue that fight, to make sure that the money goes to communities like Roseland on the greater far south side of Chicago. Finally, I want to thank Senator Emil Jones, Representative Slaughter, the entire Black Caucus. Thank you, Representative, for being here from another like community on the southwest side of the state. But if it wasn't for the Black Caucus and leaders like Senator Jones and Representative Slaughter, Camille Lilly, Roseland would have been closed a year ago. We're here to fight another day, and I'll be as tired as I have to be, but we'll never give up the fight. Thank you very much.
All right, I think it's still morning. Good morning, everyone. Justin Slaughter, Illinois State Representative of the 27th District, representing the far south side of Chicago, southwest Cook County suburbs. My home, Safety Net Hospital, is Roseland, which has been there for 95 years. Just wanted to kind of touch on a few things here. I agree with everyone in regards to what they've said. I also want to thank the hospital leaders and advocates for being here, pushing this initiative. One thing that we know, and this is spanned across both a Democratic White House and now Republican White House, the U.S. Department of Labor has said time and time and again, healthcare will be the driver of our economy. And so it's important that we leverage the fact that in 5 or 10 years, our economy is going to be fueled by healthcare jobs, primarily hospital jobs. And so when you think about what's going on with this capital bill, it's important to invest in a lot of the data and research in regards to where we're taking our economy. Also, the need for services. Let's not forget underserved communities are continually disproportionately impacted by many things, right? Whether it be the quality of education, job opportunities, of course, our criminal justice system. But one thing that has kind of been forgotten is our health. Our public health services and programs, whether it be diabetes, certain cancers, sickle cell, asthma. We are disproportionately impacted, by the great quality of programs and services and treatments that our safety net hospitals are able to provide. We know that for a lot of our constituents and residents, safety net hospitals are really the last resort in terms of being able to access some of these critical services that they need. Lastly, it really is about jobs. Just at Roseland, Tim, how many folks do you employ? 400 people are employed by Roseland Hospital. In a concerned era now where we're looking at cutting jobs, job opportunities being decreased, we certainly want to keep intact a lot of our anchor institutions that do hire and have employment at a high clip. what we're doing with this capital bill is being able to increase that and bring more jobs to the community. And so what we're asking for, I believe it's 150 million. Is that it? It really should be more than that, but hey, we'll start at we'll start at 150 million. This is very, very critical to underserved communities, and so I stand here in solidarity, just proud of the hospital leaders in regards to the message that they are pumping, and this is a fight that we're going to fight to the end in regards to getting that investment. So thank you for being here.
Good morning. Senator Emil Jones, State Senator for the 14th Legislative District. Roseland is in my district, and yes, as Tim Egan stated, I do suffer from asthma. I can recall a couple of years ago, I was having a slight asthma attack, and where did I go? I went to my local hospital, Roseland Hospital, and let me tell you, I'm standing here today. After I left up out of the hospital, I was able to do a 5K run that very next hour. So thanks to Roseland Hospital in my community. It provides health care to the most needy, like Tim and other healthcare leaders up here have gave you all the statistics and stats. Roseland is my biggest employer in the district, in the Roseland area. And I believe we will get this capital plan done. We haven't done one since 2009 when I first was elected into the General Assembly. And it's well needed that we get one done. As Tim stated, these last 4 years has been kind of, a challenge for safety net hospitals and even regular hospitals throughout the state. This whole state has been held hostage, and it's time that we move forward. And I believe the General Assembly will come together along with the governor and make this happen. Yes, we're requesting 150 million, but I'm looking to get more. From what I hear, we're looking to do several billions of dollars in capital, and there's no reason why we cannot take care of our safety net hospitals. So I'd like to thank all my healthcare leaders for coming out and coming down here to advocate for their hospital, and I look forward to continue working with you all throughout the years. Thank you.
James Cifuentes from St. Anthony Hospital in Chicago's up next.
Morning, everyone. St. Anthony Hospital serves the west side of Chicago and the southwest side of Chicago, communities impacted by trauma. When you think about the social determinants of needs, health access comes in these areas, and areas similar to everyone else here. People that deserve to have health care, people that deserve the highest quality of health care. St. Anthony's building is 121 years old. We've been serving immigrant communities for that long, and the African American community. What we're asking is that the governor and legislature invest in health care to bring our facility and facilities like ours up to the 21st century. I'm a kid from the back of the yards, one of the neighborhoods that we grew up in, and there's no reason why people like our communities, right, all they want is chance. And to give them a chance, you got to invest. So I'm asking the state to invest in the biggest asset that there is, the communities and the residents of these communities, to give them the quality of health care they deserve. St. Anthony Hospital has been a staple. They employ 1,000 people within a community, and we focus on the communities that we serve. So I'm asking again, along with my colleagues here, to move forward with the capital bill. Thank you.
Next up is Jordan Powell, President and CEO of the Illinois Primary Healthcare Association.
Good morning. Again, my name is Jordan Powell. I'm the President and CEO of the Illinois Primary Healthcare Association. Our organization actually represents federally qualified health centers, also known as community health centers, that provide care to more than 1.4 million patients at 380 sites throughout the state of Illinois. And we stand here today in strong support of including vertical projects in a capital bill, and are proposing a $125 million investment in health centers to build new sites, upgrade current facilities, and purchase medical equipment to expand access to care in underserved communities. For those that aren't aware, community health centers provide comprehensive and integrated care to anyone in need and regardless of their ability to pay. And our model of serving the whole person and addressing their individual needs, whether it's medical, dental, pharmacy, or mental health services, is consistent with the changing healthcare landscape that seeks to increase healthcare outcomes and reduce healthcare costs by focusing on primary care and preventive medicine. Community health centers are also on the front line of the fight against the opioid epidemic by offering medication-assisted treatment and recovery support services. Additionally, research demonstrates that health center outcomes actually meet or exceed non-health center providers, and significant savings are achieved by keeping patients out of the emergency room and reducing the need for high-cost specialty care. In fact, Illinois health centers save the state 27% per Medicaid patient. And in terms of financial health and stability, community health centers are major employers and buyers of goods and services within their communities, delivering an economic impact exceeding $2.4 billion on an annual basis. So as the Governor and General Assembly consider a capital bill, vertical projects must be included to further transform our healthcare delivery system. And specifically, an investment in community health centers will deliver long-term value and will undoubtedly have a positive impact on the physical, mental, and economic health of our state. And with that, I would now like to turn it over to one of our members, Donna Thompson, with Access Community Health Network. Thank you.
Thank you, Jordan. Good morning. I'm Donna Thompson. I'm the CEO of Access Community Health Network. But more importantly, I'm a nurse for 42 years that started in Central Illinois. And I must say that from my days at the bedside to now being the CEO of Access Community Health Network in Chicago, that serves 16 of the 20 poorest communities, as well as the suburban Cook and DuPage counties, the folks that are still suffering in silence are out there. Now, when we think about how we're going to turn our historical way of treating patients differently, it's by partnerships and assuring safety net hospitals like Roseland, Mount Sinai, and others throughout the state of Illinois, as well as community health centers, continue to partner and make sure that people go through the right portals of care for the right reasons. Preventative services are a hallmark of FQHCs, and making sure that people have a health care home where they know their provider, but also a place in their own community. As Mr. Egan said, it is a shame if someone has to drive 50 or 60 miles to get to a place where they feel comfortable and where someone will take them. But it's also a shame in the urban area if someone has to take 3 buses and a train to get to a place where they'll be seen. The investment in FQHCs and safety net hospitals are really an investment in our future. It resets issues around health equity, and more importantly, it starts eradicating a lot of the shameful disparities we see in so many communities. Thank you.
I realize we're pressed for time, but we have time for a couple of questions. We'll open it up.
Is it 150 million or 125 million, or is it 275 million you guys are asking for?
So we have a separate request from the safety nets. So for Illinois community health centers, we're requesting $125 million.
But the legislators that were here, they're requesting an additional 150 million. Is that right?
It's my understanding that that's the request for safety net hospitals. They're 2 separate providers.
Okay, all right. So again, this event here is looking at $275 million to be included in a capital bill for these various things.
Right,
okay.
yes.
How do we go about paying for it? That seems to be one of the big sticking points here. Everybody's talking about roads, bridges, buildings, universities, but how do we go about paying for this?
Right, I think that's a great question. As you know, there's a number of revenue proposals that are being considered right now by the legislature, and it's fair to say that IPHCA, the organization that I represent, supports many of the revenue enhancements that have been proposed by the governor. And I know that IHA, Illinois Hospital Association, IPHCA, for example, have come out in favor of the cigarette tax. That's one example. With that said, we're willing to work with anyone to expand access to comprehensive and integrated care, which will ultimately save the state Medicaid dollars.
So I got an answer. Can I expand on that? So if you listen to JB's inaugural budget address, he mentioned the MCO tax.
Right.
So this MCO tax is something that we've been working on, and I know I personally came down here 3 years ago and testified at a hearing about why this would be important for Illinois, and other states are doing it, Michigan, California, so why are we not doing this yet? This is something that JB has said, that this is going to push this forward. Now, early calculations said that could generate $800 million new dollars for Medicaid. So there's a pool of funding that's available to fund these projects, and $150 million, unfortunately, isn't enough. If you recall, it was mentioned that there was a capital bill that was done 10 years ago. Each state and a hospital got $7 million. Now that's $7 million 10 years ago. There hasn't been an investment since. So this $150 million just isn't enough, and there is a source of funding for it.
That MCO assessment,
Yes.
from my understanding, correct me if I'm wrong, that's a tax on insurance?
So it's a tax on every claim that's paid, right?
Mike, get
Yeah.
to the
Oh,
mic.
sorry. Thought my voice was loud enough. Yeah, it's a tax on every claim that's paid, and if you look what they did, and the way we termed this 3 years ago when we pitched it to the legislators, it was a Michigan lookalike tax. They did this with a Republican governor, a Republican-controlled legislature. They got that passed, and it generated hundreds of millions of dollars for Michigan. So it's the same idea to do it here in Illinois. And now that we've handed over all the Medicaid lives to the MCOs, and they are woefully behind in paying us, I don't see a problem with putting a tax on them.
Now, the safety net experience is probably thoroughly different from what I have in Springfield, I'm guessing, but, you know, between everything, when I go to the hospital, it's not a cheap day. And the guys that run the two hospitals in Springfield are among the best compensated in the community. I don't know if that's the case in the safety net hospitals, but I kind of wonder about, you know, more tax dollars for healthcare, knowing again that the experience you folks are talking about may be, you know, planets away from what we have in Springfield.
Well, I can't give you the view of Springfield, but I can give you the view of 111th and State on the south side of Chicago. Last January 1st, I had to go through 10% layoffs, 10% reduction in our salaries to the entire staff, 25% reduction to our executive staff, and I had a 100% pay cut. I didn't get paid from January 1st to June 30th of 2018. So that's a different view, and that's a safety net view.